Assalamu alaikum. This is Dr. Omar Shakori, and today I am sharing with you the Chinese experience in coronavirus infection. This day we had meeting with a team, international team with the Chinese hospital. This is Dr. Omar Shakori, accident and emergency surgeon from Mosul, Iraq. The team that we met them were from the fourth affiliated hospital in Xinjiang University School of Medicine, and this is a picture from the live meeting on Zoom, and this is a picture of their hospital. In this meeting, we just sent our question to them just before the meeting, and we got an answers for our questions, and there are some live questions. So I tried my best to collect these questions and their answer and put them here in this video. I hope this will help you in your practice. So let's move on to the first question. The first question that we ask them, how to use CT scan in COVID-19 diagnosis, how they use the CT scan, computed tomography scan for COVID diagnosis. Their answer was a positive result of a nucleic acid of SARS-CoV-2 is a gold standard for the diagnosis. However, considering the possibility of false negative, as you know, there's false negative result for this nucleic acid detection. So, suspected cases characteristic manifestations in CT scan can be treated as confirmed cases. They treat a suspected case with positive CT as a confirmed cases of COVID-19, even if the nucleic acid test was negative. Isolation and continuous test of multiple specimens should be carried out in such cases. This was our first question. The other question was about sensitivity and the specificity of PCR exam. So in fact, they answer there is limitation of sensitivity and the specificity exist in all testing methods. What they did, what we should do in clinical laboratories is to assess verification of kits and choose suitable one to be used. Before a new test can be used in a clinical laboratory, the performance characteristics of the procedure must be confirmed. Laboratories should develop an improved SARS-CoV-2 verification framework compared with the traditional molecular diagnostic method. In our laboratory, in China laboratories, we have assessed three types of RNA kits mainly used in China, and they choose the best one for testing. Additionally, it's crucial for clinical laboratories to improve the quality management of SARS-CoV-2 RNA test, especially some laboratories with poor operational conditions. Now, what are the other helpful investigation in the diagnosis of COVID-19? In addition to CT scan and PCR, the most important is the epidemiological history, and the fever or respiratory symptoms are helpful. The blood test routine may give some investigation. In early stage of COVID-19, the leukocytes could be normal or low and lymphocytes decrease. This is occur in early stage of COVID-19. Now, what are the modalities of management and the treatment of COVID-19 that they did in China? They must be the first thing, the first step, they must be isolated. The patient must be isolated and have a sufficient rest and energy supply. Oxygen therapy should be given in time when they need it, and antiviral therapy such as interferon, alpha interferon, arbidol, lopinavir, ritonavir, chloroquine, hydroxychloroquine can be used, and they use traditional Chinese medicine. If they are severe or critically severe patient, they need respiratory support, circulation support, and other therapies such as glucocorticoid. So they said that we use the glucocorticoids for the patient in severe or critically severe patient. For other patients, they just give them supportive treatment by a good rest and good energy supply and oxygen on need, and they give antiviral therapy, and sometimes they give chloroquine and hydroxychloroquine. We ask them, is there any possible available drug for prophylaxis against COVID-19? So their answer was, we use thymolphacine. Some doctors suggest hydroxychloroquine can be used, but we do not use this drug to prevent COVID-19. And we must pay attention to the side effect of this drug. So they didn't use hydroxychloroquine for prophylaxis. This is their answer. Can we use a scoring system to diagnose COVID-19 cases? This is a good idea, but until now there is no suitable scoring system according to their answer. What to do if a patient CT is highly suggestive of COVID-19 while the PCR is negative? So, this is important question. You have positive CT, negative PCR. What they did in China. First, we must know the patient whether have epidemiological history or not. If the patient epidemiological history is positive, I think the patient is a suspected patient. We do the PCR more times. Some patient diagnoses in the 7th times, not just the 2nd, not the 3rd, not the 4th. They recorded patient diagnosed from the 7th time PCR or more even, and do the PCR even about the stool, the urine, the blood, and do the serum test if possible. If the epidemiological history is negative, I mean epidemiological history mean no travel history, no contact with positive cases, we give some therapy first, for example, antibiotic. If the CT do not go to better, they will do more PCR again for many times. So again, what if positive CT? If positive CT with negative PCR, what they did this. They look in the epidemiological history of a patient. If epidemiological history is positive, this is suspected patient. If this is not positive, they will give, if the patient has no positive epidemiological history, they give antibiotic and then recheck the CT again. If not improved, if the patient not improved, they did a serial PCR for that patient. We ask them also about what is the management protocol in general surgical department at the corona area. So their answer was to stop all elective operation, and for confined operation like cancer and emergency operations, patients need to do both the RNA test of coronavirus and CT scan of the lung before the operation. Pre-operative discussion should be performed to make sure the necessity and emergency of the operation. Surgeries of diagnosed or suspected patient. Surgeries that we will face it in a diagnosed or suspected patient should be operated in separated negative pressure room. We need separated negative pressure room to operate on such patients. All the medical staff should prepare in level 3 personal protective equipment. We will speak about the levels of personal protective equipment for each person, each level. So in this condition, in surgery, in diagnosed patient, we need to be prepared by level 3 personal protective equipment. For emergency patients who cannot be screened immediately, like the patient has life-threatening condition, what they did, they treated them as a diagnosed patient and do the surgery as a diagnosed patient. So they prepare in isolated, separated negative pressure room, and they take a level 3 personal protective equipment. Now, we also go more in the details of operations. So we ask them, what's the change on operative room checklist regarding corona pandemic? They added epidemiological investigation list for all the patients that need operation. Which is composed of the questions like, are you from an epidemic area? Do you have any respiratory symptoms such as fever, cough, sore throat, weakness during the last 14 days? Are you exposed to the diagnosed patient or people from the corona area? They put this question in the checklist before operation. Before each operation, the surgeon, the anesthetist, and the nurse should validity check the information of the list. The result of RNA test of coronavirus and the CT scan of lung. As we mentioned here, they sent a patient for CT for RNA test and take epidemiological history before any operation, unless they have a life-threatening condition. Here they treat this patient as a diagnosed patient. Other question also, we ask them about the proper and competent sterilization rules following the handling of surgical or medical appliances after working on COVID-19 patient. For example, you did surgery on COVID-19 patient, or you did medical intervention on COVID-19 patient with medical tools, medical or surgical instruments. So what is the proper sterilization for this? Their answer was, the best is to use a single use instruments. But if you have shortage in these single use material, you can sterilize the surgical instruments by chlorine. You can sterilize them by chlorine for half hour, and after that put like this, put the scissor, put the scalpel inside the chlorine for half hour, and then remove it. Keep it aside for 4 days. Keep this instrument for 4 days, and later on sterilize them as usual, and you can reuse them. That's their advice. Now, other question, we ask them about the shortage of medical supplies. The shortage of medical supplies. Is there possibility to reuse the materials? They said the surgical and face mask, the medical and face mask and surgical face mask cannot be reused, but the goggles can be reused. Other question was how to protect yourself as a medical employee and your family. This was a vital question. How to protect yourself and your family. So they answer like this. There are few steps we need to teach the medical employee about those steps. Number one, teach the medical team how proper wearing the personal protective equipment. Teach them how to wear the personal protective equipment. This is number one. Number two, teach them also how to monitor themselves regarding temperature and respiratory symptoms. Teach them how to monitor themselves regarding their temperature and respiratory symptoms. If they develop any high temperature or respiratory symptoms, you have to tell them to isolate themselves in their homes for 2 weeks, not to come to the hospital, not to come to the work. So again, how to protect yourself as a medical employee. Learn how proper to wear the protective equipment, the personal protective equipment, and learn how to monitor yourself regarding your temperature and respiratory symptoms. And if you develop any of them, like high fever or respiratory symptoms, you have to isolate yourself, not to come to the work. Now, is it expected that this virus will disappear in hot weather? They said no evidence for this. No evidence for this until now. Now, we ask about also the new modes of early diagnosis. The new modes of early diagnosis, they said, and again, and they focus on this. They said that we must pay attention, most attention to epidemiological history, and the second is the CT. The second is the CT. The last one is PCR. So they depend on epidemiological history and they depend on CT scan. The fever, after that, the fever, respiratory symptoms are helpful, and the last thing is the PCR. So again, depend on the first thing, the epidemiological history. The second is the CT, and then the features like fever and respiratory symptoms, and lastly the PCR. Is there any serological test available nowadays for COVID-19? They said that IgG and IgM are elevated or are positive in patients with COVID-19, but they are not specific for COVID-19. Later on, we ask them about the last treatment protocol. The last treatment protocol. The last treatment protocol in China regarding COVID-19 contain 4 steps. Number 1, isolation. Number 2, monitoring. Number 3, treatment. Number 4, follow-up. Again, isolation, monitoring, treatment, and follow-up. The treatment is contain healthy eating, antiviral, antibiotic, oxygen on need, suction if needed, and ICU, intensive care unit. Again, The four main lines for the last treatment protocol in China are isolation number one, monitoring number two, treatment number three, follow-up number four. The treatment, the specific treatment, they give a healthy eating, antiviral medication, antibiotic medications, oxygen therapy on need, suction, and this is important to have a sucker beside the patients, and ICU if the patient develop more severe symptoms. Now we ask them, can we use hydroxychloroquine as a prophylaxis? Some doctors suggest hydroxychloroquine can be used as a prophylaxis, but the Chinese doctors do not use this drug for a prophylaxis, and they give attention about the side effect of this drug. They do not use hydroxychloroquine as a prophylaxis. Now, doctors in Chile ask them, can you describe mistakes that done by doctors in China that other doctors can avoid? They said at the beginning of COVID-19 epidemic in Wuhan, we know very little about the novel coronavirus. Some healthcare workers didn't pay attention to wear the personal protective equipment, and some of them were infected. During the pandemic of COVID-19, the investigation of epidemiological history, and again they are focused on epidemiological history, it was very important for detecting the patients who met. They said we met a patient who denied her epidemiological history, but in fact she was closely contacted with the person returned from Wuhan City. Until the third time she came to the fever clinic, the doctor investigated the epidemiological history again and detected the patient epidemiological history was positive, and the patient and her families as a confirmed cases. Now, isolation units in the emergency department, how important do you think they are in the care process? This is a question they ask about. Their emergency department contain only 3 isolated units. So they ask about, is it important to have isolated units inside the emergency department? The isolation units are very important. Isolation units can protect the doctor, the nurse, and the patients, other patients. But if it is limited, we can use a building far from other buildings. They can use a building far from other buildings. How do you treat heart attack during pandemic? Do you keep using percutaneous coronary angiography or made thrombolysis? They said we keep percutaneous coronary angiography when necessary, but if the patient is suspected patient, they do it in another place. They do it in another place. We also ask them about how do you treat a recovery patient. As you know, we have cases in our locality, we have cases, and those cases are some of them get health again, healthy, wealthy, and we have to discharge them. So how we will treat those recovered patients? So they said that they have a respiratory clinic for follow-up. They have a respiratory clinic for follow-up. And they found that the oxidation drug does not give very clear result, not very useful. What is useful, they found that those patients who develop a new fibrosis, a new lung fibrosis, they found the recovered patient and those develop fibrosis, the best for them is lung rehabilitation. Lung rehabilitation. We have to do post-recovery lung rehabilitation for those patients. Now, what kind of personal protective equipment do you recommend? This was a vital question, very important question for all of us, the protection and the PPE. So they said we have three levels of protection. We have protection level 1, protection level 2, and the protection level 3. They use protection level 1 in a common clinic zone, the common consultation clinic zone, and they use the protection level 2 in the fever clinic, especially for fever clinic and for the triage team including the emergency team, and they use a protection of level 3 for observation ward and quarantine ward, also protection level 3. So let's see each level. Now the protection of level 1. Level 1 protection. This is used for normal clinic. They use only a working clothes with a surgical mask and disposable hat. Surgical mask and disposable hat with normal clothing. Normal working clothing. This is used for a normal clinics and normal consultation ward. Number 2, the protection level 2, which is used in the emergency department, triage zone, and fever clinic. Here we have a doctor and caregiver and medical caregiver working clothes with disposable hat, goggles or face shield, and medical protective mask, not only the surgical mask, medical protective mask, which is N95, and disposable gown, and disposable gloves and shoe cover. This is the protection level 2. Now protection level 3, which is used for observation ward or quarantine ward, they use a protection level 3, which is working clothes with disposable hat and face shield or goggles, medical protective mask, disposable isolation gown, double gloves. I will focus on this, double gloves, not single-used gloves for those who are working in quarantine ward or observation ward, and shoe cover. Also, they told us that inside their hospital they make three teams. The first team is responsible for receiving the patient. The second team responsible for treat and follow up the patient. The third team is the team who is responsible on bringing the PPE for the first and second team. So again, they have a team for receiving a patient, they have a team for dealing with treating and follow up the patient, and they have a team for bring all the needed PPE for the team 1 and team 2. Also, we ask them, do we have to consider all patients that come to the emergency department, like a patient come with a broken legs or with a traumatic brain injury, as infected patient? They said No need to consider all people or patients are infected. Also, we ask them, do you have a special criteria to admit the patient? With your experience, is there any predictor? Again, they said the same protocols that they are following. The epidemiological history and the chest CT scan are very important. And fever, respiratory symptoms, blood routine investigation are helpful too. And the last thing is PCR. So they depend on epidemiological history and CT scan, epidemiological history and CT scan, and the features. And the last thing is the PCR. The last thing is the PCR. Also, we ask them about, is there any predictor for intubation, any indications for intubation the patient? Is there any indications to intubate the patient? The criteria, this is question 10 and question 12, the same. Is there, what are the criteria for intubation? They said that there is no specific criteria for intubation. There is no specific criteria for intubation. They depend on systemic manifestation and systemic deterioration of the patient. So no specific criteria for intubation. Also the question, when when do you have, we ask him, and this is very critical question, we ask them, when you have a positive patient with the mild symptoms, as I mentioned in the previous class, I will put the link for that class in the description about the infection control training course. I said that coronavirus patient, 80% 80% of them are mild symptoms, and 15% have moderate symptoms, and only 5% have severe symptoms. So we ask them, what you are doing with those patients with mild symptoms? Do you send them to their home or you admit them to hospital? They said, if we have enough beds, we will admit them, but if we don't have enough beds, we will send them to their homes, but they must monitor themselves. If they have symptoms, they must come back to the hospital. They must go to the hospital. Now also we ask them about how you are pre-oxygenate or how you oxygenate those patients with hypoxia, the COVID-19 patient with hypoxia. They said that the high flow nasal cannula, the high flow oxygen through nasal cannula is the first line. High flow oxygen through the nasal cannula is the first line. If nasal cannula is not available, use Venturi mask. If nasal cannula not available and Venturi mask not available, you can use face mask, but this is last option. And remember, you may need intubation at any time. So again, what you will do in cases of hypoxia, in COVID-19 patient, you can start high flow oxygen through nasal cannula. Now, what about the personal prevention recommendation for personnel who are not attending COVID area? That means that, like a doctor who is not working in the care area, not working in the COVID area. This is the same like doctor working in just consultation ward. You can use the protection level 1, which is the surgical mask, and working clothes and disposable hat. Surgical mask, disposable hat, and the working clothes. Just before we finish, we ask them a direct question. I ask them a direct question about the time after sterilization of an area with a suspected COVID-19 patient. For example, we are working in the emergency department. A COVID-19 suspected patient enter this emergency department. How to disinfect this emergency department? Simply use a chlorine. They said simply use a chlorine and sterilize everything in that area and wait for half hour, and you can reuse this area again. So after chlorine, wait for half hour, you can, after this, you can reuse this area again. And they advise for 3 times daily of using disinfection for the emergency department. 3 times daily you have to use disinfection by chlorine and sterilization by chlorine for the emergency department. Thank you for being with me in this class. Please put any question below this video in the comments and I will answer that. If you like this video, don't forget subscribe and see you in the next video. Have a good day. Bye bye everyone.